Today, my guest is from Frontline Care Solutions. He's Dr. Drew Dwyer. He's a consultant gerontologist, and he's here to talk to us about something of deep interest to everyone in the aged care industry, the aged care funding instrument. Drew, welcome to the show.
Thank you, Wayne. Thanks for having me.
Now, I understand that the aged care funding instrument, ACFI, is changing again.
Yeah, well, what is known as ACFI, ACFI, is the aged care funding instrument. Now, funding specifically is of huge concern to everyone who is entering the aged care system. The ACFI funding actually only funds people who move into a nursing home or traditional nursing home, or what is known today as a residential aged care facility. Now, the ACFI funding is, of course, run by Medicare, and it is a funding system that pays a gap in the service that's been provided to somebody who's already paying to be in a nursing home. So the funds basically sit as what Medicare will pay you as a citizen and fund the provider who's providing you resources to care for your health conditions in a nursing home as you go through your final stage of life.
Now, Drew, when the federal government introduces changes like this, don't they run courses themselves? What's the benefit in the work you're doing? Okay,
so they do, but they run courses primarily, and people understand this, in the systems, the processes, the documentation, and the ticking of boxes. So the courses run by the government are great, but they specifically focus on the fundamentals of the government system and the working process of the cogs in the wheel, and how to actually fill out a document, tick a paper, and be validated for audit of the government so that you are meeting the regulatory requirement and that they will allow you and approve your funding. The biggest issue with this is they don't delve into the context of how to apply this funding instrument in a real bedside, lifelike situation, and particularly for clinicians and mainly registered nurses in aged care or physiotherapists and allied health. They have to validate through this ACFI system that their clinical assessment, their diagnosis and their care plan is at the best practice guidelines that actually validate the rationale for the resources that are being used for the person's care, and that the government, when they audit the funding, can clearly see that they have applied proper best practice and clinical practice. Now, one of the issues is many people lose their audits because they're writing and designing the care specifically only to meet the ACFI instrument or the funding tool. And in Frontline, we don't work in that space, because I always say, much to people's not liking it, but you can train a monkey to fill out a box and tick a document. It's not that hard. But it requires specialised skills from clinicians to maintain a focus in the best practice of care, but at the same time understanding this process will be affected by a funding instrument. And it's not so much to design your care to meet the funding, it's to design your care to best practice so that every resource available is valid because you have proven the resource is needed. So I actually teach what is known as a multidisciplinary case management framework so that clinicians can actually step through a sequence, they can validate, and they can be very confident that the normal work they do will stand up to any audit of any funding instrument. And they don't have to then cloud their judgment or their critical thinking or clinical decisions by simply trying to force it to match up to a funding instrument. So I work in the reverse, and the clinicians connect with this very well.
Now, in the last 6 months of 2018, I understand you're running live seminars pretty much right across Australia for this, and webinars as well. If people go along to one of those live seminars, apart from meeting your good, charming self, do they come away with useful things they can implement straight away?
Yeah, well, Frontline focuses on its 3-word motto, and that's understanding, support, and leadership. So part of that process is Frontline understands the role of the person who's coming to that seminar. They're generally a clinician, a registered nurse, allied health person, and we want to support them So we take that knowledge of their systems and processes, and then we use our own documentation. It's a general documentation, assessment forms, guidance, tools, and things that support the assessment and care planning for elder people in care. And at the end of their training, we give them the leadership through the training and knowledge, and we lead them towards our cache of documents on the internet, and they're able to pull down those documents that they've learnt and used in the seminar workshop all day, and they can take those instruments back to their workplace and implement them or blend them with other things. But really the clinicians that come, they just don't want knowledge. They want practical implementation. And we give that by understanding what their needs are, supporting them with the right documentation and validation, and then teaching and leading them the sequence of how to do it. So they come away with not just knowledge, they come away with supportive tools, documents and resources, which is really a bonus for anyone who attends the course.
And Drew, for anyone who wants to know more, I'm guessing that's on your website at www.frontlinecaresolutions.com, and they can register and so on there.
They can. And so if you're getting lost, you can also just Google ACFI training, and of course Frontline comes up at the top. It's probably, Wayne, with boasting for Frontline, our most heavily attended course, because the transitions of clinicians and people in ACFI is ever moving, and of course the government is forever moving the rules and regulations. But it's very popular because of that factor we spoke before. Clinicians come, we aim it from a different angle, and it basically closes the gaps that the government course has taught them about the system. They more or less get that aha moment.
Well, we all do well with an aha moment, Drew. Hey, before I let you go, and time's pressing, in having a look at your website about ACFI, I noticed there a seminar that tells me I can get the clap from Dr. Drew. What's this all about?
Yes, well, we've designed Frontline asked me to design a new course. They're getting a large amount of interest from the healthcare sector across all domains. So, of course, Frontline is a care solutions provider. We work across a lot of domains, but clinical leadership is an emerging critical factor in healthcare. So healthcare clinicians and practices of clinicians are now elevating, and businesses, hospitals, healthcare organisations are wanting their clinicians to be espoused in clinical leadership, because clinical leadership is an evidence-based, well-known knowledge in the literature and research. Professors like myself understand this. We teach it at universities in small segments to equip clinicians to be prepared for leadership in a clinical domain. Our course, called a CLAP course, which stands for Clinical Leadership for Advanced Practice, is a course that is written for all clinicians from any domain who want to understand and learn the skills, which are primarily soft skills and complex skills, where it establishes them if they are in a position of management and leadership and decision making, or they are wanting to move to those higher end clinical positions: nurse unit manager, clinical manager, hospital manager, but they are clinicians. Our course prepares and teaches a series of modules which gives them the fundamental principles and the knowledge of mastering clinical leadership as a competency to help advance their practice and give them confidence in an advanced role in clinical work. So it's aimed at all clinicians, doctors, nurses, allied health, anybody who is sitting in a role or looking at a role of wanting to be advanced practice. And advanced practice, of course, is quite holistic. You have to deal with other clinicians, people, consumers, management, and it requires refined skills in emotional intelligence, in critical thinking and decision making, in managing services and resources, and confronting conflict, and a whole range of things. So the course is done as a face-to-face workshop to begin, and then the students move into our online learning program where they complete a series of modules to give them a certificate in clinical leadership for advanced practice. And I'm busy working at the moment to look at having this course identified and accepted by a couple of universities who will allow it to give credit points into a master's or a grad dip course in clinical leadership. So it's exciting stuff, But of course, many clinicians also are too afraid to just jump straight into a master's degree at university because the complexity of that is hard to take on when you're working full time. What our course does is slowly builds the skill, transitions, and allows that clinical leader to be a master in what they're doing and to have more confidence. So, yes, it's a good analogy. Come and get a dose of clap with Dr. Drew, and we'll work with your clinical leadership in advanced practice.
It does sound like a great course with an unfortunate acronym. Drew, it's been a pleasure having a chat with you today. Thanks for giving us some time.
No worries. Thanks, Wayne. Thank you, everybody.